Health Services is a multidisciplinary, federally qualified nurse-managed health center. We offer comprehensive services inclusive of primary care, dental, behavioral health, substance abuse treatment, pharmacy services, and we're continuing to grow by the day. Additionally, we offer a lot of student engagement and allow advanced practice nurses, pharmacy students, and dental students to learn here. We serve primarily the uninsured and underinsured, so that would be the Medicaid population, Medicare, completely uninsured and self-paid patients. We're also starting to get into private insurances, but that's a very small portion of what we do here. Pharmacy has many services. One, we provide medications at low cost to patients who are uninsured. And we can do that because we are a federally qualified health center, so we get discounted pricing. We also provide a variety of clinical services, one being pharmacy visits, where they come in and we manage medications independently of the providers. And then we also do shared visits with the provider, where we see the patient in collaboration with the provider and can assist with medication recommendations and follow-up.
I like the autonomy of this clinic, working with providers too, and part of the things we do is have patients come in for managing their warfarin therapy, because warfarin is a very dangerous drug in terms of a blood thinner. If you overdose them, it can be dangerous in terms of bleeding risk, or if you underdose, it's clotting risk. So there's a lot of risk factors to it, or things that can change the dose or the INR level. So pharmacy kind of helps manage that in terms of their care.
Well, I've had the pleasure of working here for about went on to my 4th week. And what I have found to be the most rewarding is working directly with patients in the 303 program and doing the pharmacy visits that Connie had referenced to in regards to having patients come in and talk to them about their diabetes medication and treating the patient wholly, thinking about their diet, their activity, and how that affects their medication. And having that ability to interact with the provider to help them titrate the patient to a dose that would be very helpful for them and keep them in control.
My life a lot easier. We have an adjunct pharmacy, and the medications are dispensed here on a daily basis, and we have 5 to 6 different providers on any given day, and we're a high utilizing internal medicine / urgent care, but we're named as a federally qualified health center, so without our pharmacy students we'd be staying here until 9 and 10 o'clock, so they help us significantly looking things up whenever we needed, doing interaction checks, figuring out if there's a disease interaction, figuring out how to dose appropriately, doing follow-ups, doing 2 or 3 protocols for diabetes. It helps us significantly with our practice. I miss them when I'm at my other practice.